Thank you very much to all our regional leaders who came on board and shared their valuable insights with the audience today. Next, ladies and gentlemen, is the address by the guest of honor this evening, Professor Anita Simonds, Professor of Respiratory Medicine and Sleep Medicine, Imperial College London. To introduce our guest speaker to this esteemed audience, I would like to invite Dr. Sachini Seneviratne, Joint Secretary of the Sri Lanka College of Pulmonologists.
Good evening, ladies and gentlemen. Apologies about my voice in advance. So it is my great pleasure to introduce to you Professor Anita Simonds, who is an icon in the field of respiratory medicine. So she's currently serving as an honorary consultant respiratory and sleep physician at the Royal Brompton and Harefield Hospitals. She's the Emeritus Professor of Respiratory and Sleep Medicine of National Heart and Lung Institute, Imperial College London. She is also the Harvey Librarian of the Royal College of Physicians. So she has been the author of many publications and has produced many guidelines and is truly one of the world authorities in non-invasive ventilation. Thank you so much for gracing us with your presence today. We would love to hear a few words from you. Thank you.
Thank you very much indeed for that introduction. It's a huge pleasure and honour to be here, and I too must thank our President, Dr. Dissanayake, the whole of the organising committee, our past presidents, members of council, and of course guests and esteemed members of the audience. This is an absolutely fantastic Congress. The programme committee deserves an award, I think, and we're looking forward to 2 days of cutting-edge pulmonology, and I'm also very much looking forward to the lecture on aspergillosis that's coming up shortly. On a personal note, I took part yesterday in a workshop on non-invasive ventilation in neuromuscular disease and chest wall disease, which was expertly organised by Drs. Widana and Wadasinghe. And I really enjoyed the enthusiasm and knowledge of the participants. It was also a particularly important workshop because it was the combined endeavours of the College of Pulmonology and the Association of Neurologists, and we had adult and paediatric neurology colleagues there, and great discussions afterwards. I hope we can take that forward tomorrow morning for a session at 7 a.m. when we're discussing streamlining home ventilation management with colleagues, working together on best delivery options to improve non-invasive ventilation for Sri Lankan patients. What I'd like to do now is briefly cover two historical aspects. We've heard a lot about the very important topics of air pollution, smoking cessation, lung cancer, asthma and COPD, and very eloquently discussed. But as you just heard, I recently took up the role of Harveian librarian at the Royal College of Physicians, London. It's not quite being a librarian. You have access to the ancient books, but also to the museum and importantly to the archives. And so I took the opportunity to look in the archives and see what was there of information from the past over the last few centuries between our countries, Sri Lanka and the United Kingdom. Not surprisingly, there was a lot there to see. There were fantastic records, in fact, dating back to the late 1700s and 1800s, looking at comparative data from hospitals across Sri Lanka on malaria, also on mental health disorders. Also, you won't be surprised to hear that what I came across pretty quickly was the work of Dr. Chris Gunastasa Uragoda, who is memorialised in the inaugural lecture today. And sadly, as we know, he died in 2020. But he truly was a polymath. He was a pulmonologist who had a special interest in occupational lung disease following exposure to cinnamon, graphite, sulfur dioxide, and ilmenite. And of course, as you all know, it's strange for me to be telling you this, but I think there are some important messages perhaps for our guests and visitors here. He wrote the seminal textbook, The History of Medicine in Sri Lanka, which was published in 1987. And he was managed to weave in not only Western aspects of medicine, but also traditional cures and cares, and he was a wise folklorist, a really early pioneer of conservation. I know virtually everyone in the audience will also know about some of his magnificent detective work, particularly in the story almost worthy of Sherlock Holmes, and discovering why some of his pulmonary TB patients experience regular episodes of flushing, urticaria, headache, and palpitations, but these were occurring regularly on certain days of the week. And he was able to identify that these were patients who were on isoniazid, and isoniazid actually blocks monoamine oxidase and also some of the histaminases, and that was why when they ate on a particular day of the week skipjack tuna with high levels of histamine, they experienced these symptoms, and much other really brilliant work that he did. Also in the archives, I came across the story of the opening of the Ceylon Medical College in 1893, and also very early on, the first female medical graduate of that college, who started right at the beginning, and she qualified the first female licentiate in 1898. And went on to work briefly and study in Scotland, where she became a member of the Royal College of Physicians and Surgeons, and then came back to Sri Lanka and worked in a new women's hospital for the rest of her life. This is Hilda de Boer. She was of mixed Burgher and Sri Lankan heritage. And not only did she work for the rest of her life in that women's hospital, but she devoted most of her time to the training and education of others. And that was the first female in medicine, but also there's so much that Sri Lanka has done with first amazing work in public health medicine, where you've been a pioneer, not least in the brilliant work in malaria eradication. And also I was hearing too really, really high rates of vaccination in Sri Lanka. My last point is, I don't think anyone appreciates long speeches, is that the subtitle of this conference is Equity in Respiratory Health for the Right to Breathe. And this is so important. With the European Respiratory Society, we've been working with the World Health Organization on a report on chronic respiratory disease, since surprisingly there has not been a recent report on chronic respiratory disease. There have been many on cardiovascular disease, obesity, and so on. This report is due publication in the spring this year, but as we know, the WHO is under threat with its funding, and so I'm not clear what's going to happen with that publication. Also under threat are activities with our colleagues at the Centre for Disease Prevention and Control, the NIH, and other aid organizations worldwide. So I think all the more reason for us to work together at this fantastic conference in the best interests of our respiratory patients. Thank you again. Bahona is Thuthi. Thank you.
Madam, please accept this little token symbolizing a lot that Sri Lanka holds, especially if you go out and see the beautiful wildlife we offer, as a reminder of your visit, as a fond little gift that you can cherish when you go home. And thank you very much for bringing out these little gems of history and for stimulating this conversation for the future. Thank you once again.